Hi everyone, I'm Robbie, a nurse practitioner with nearly 20 years of healthcare experience. Welcome to the channel where we make healthcare concepts simple. In today's video, we're going to cover 4 basic anatomy terms that healthcare professionals use every day. Anatomical position, directional terms, body planes, regional anatomy. Don't worry if those sound complicated. By the end of this video, you'll understand what they mean and why they're important. Let's start with anatomical position. Think of anatomical position as the body's starting point or reference position. Imagine a person standing upright, looking straight ahead, arms at their sides, palms facing forward, feet pointing forward. This is called the anatomical position. Why do we use it? Because it gives everyone a standard way to describe locations on the body. For example, if a healthcare provider says a patient's thumb is on the outer side of the hand, everyone knows exactly what they're talking about because they're referring to the body in anatomical position. It's basically like having a common map that everyone agrees to use. Now let's talk about directional terms. These are words that help describe where one body part is compared to another. Let's go through a few common examples. Superior. Superior means above. Your head is superior to your shoulders. In other words, your head is above your shoulders. Inferior. Inferior means below. Your stomach is inferior to your chest. Your stomach is below your chest. Anterior. Anterior means toward the front of the body. Your nose is anterior to your ears. Your nose is closer to the front. Posterior. Posterior means toward the back of the body. Your shoulder blades are posterior to your chest. They're located on the back side of your body. Medial. Medial means closer to the middle. Your nose is medial to your eyes. It's closer to the center of your face. Lateral. Lateral means farther from the middle. Your ears are lateral to your nose. They're farther away from the center. These terms may sound fancy, but they're really just directions that help healthcare providers communicate clearly. Next, let's discuss body planes. A body plane is simply an imaginary line that divides the body into sections. There are 3 main planes. Sagittal plane. The sagittal plane divides the body into left and right sides. Imagine drawing a line straight down the middle of your body from head to toe. Frontal plane. The frontal plane divides the body into front and back sections. Imagine a giant sheet of glass passing through your shoulders and hips. Everything in front of the glass is one section, and everything behind it is another. Transverse plane. The transverse plane divides the body into upper and lower parts. Imagine a line around your waist that separates the top half of your body from the bottom half. These planes help healthcare professionals describe movement, injuries, and medical images like CT scans and MRIs. Finally, let's talk about regional anatomy. Regional anatomy simply means dividing the body into different areas or regions. For example, the head region, the neck region, the chest region, the abdominal region, which is your belly area, the arm and leg regions. Instead of saying the area between the chest and pelvis, healthcare providers can simply say the abdomen. Using regions makes communication faster and more precise. Let's do a quick recap. Today we learned anatomical position is the body's standard reference position. Directional terms describe where body parts are located. Body planes divide the body into sections. Regional anatomy divides the body into specific areas. These concepts form the foundation of anatomy and help healthcare professionals communicate clearly and accurately. If you found this video helpful, please like, subscribe, and share it with someone who wants to learn more about healthcare. And remember, healthcare concepts made simple. Thanks for watching, and I'll see you in the next video.